Hello everyone, I'm Dr. Farooq Rathore. I'm working as an associate professor and consultant in rehabilitation medicine at the Armed Forces Institute of Rehabilitation Medicine, Pakistan. I'm also the member of the advisory board and representative of the lower middle income countries at Cochrane Rehabilitation. In this regard, as we celebrate the 5th anniversary of establishment of Cochrane Rehabilitation, I'll talk about the relevance of Cochrane Rehabilitation to lower middle income countries. Before I do that, I would like to give you a brief background of disability and rehabilitation services in the developing world. According to the estimates, over 1 billion people in the world live with some form of disability. That makes around 15% of the total global population. And that's why World Health Organization often says that it is the largest minority in the world. The number of people with disability is dramatically increasing in all parts of the world, specifically in the developing countries. There could be many reasons, but one of the reasons could be changing in the demographic trends and increase in the number of chronic health conditions. In addition to the fact that acute medical care is improving and we are able to save more and more lives on annual basis. And all of these lives that have been saved, let's say after a traumatic spinal cord injury or a major stroke, leads to the global pool of disability. And it's a fact that almost everyone is likely to experience some form of disability somewhere in their life. It might be a minor disability or could be a major disability, but everyone will face disability at some point in their life. Now coming to specifically disability in the developing world, WHO estimates that 80% of the person with disability in the world, they actually live in the developing regions, which you could divide into lower income countries and the lower middle income countries. In addition, another challenge is that access to healthcare services is limited for these persons with disability in the developing regions. In addition, they also face many barriers. These barriers could be mobility barrier, social barriers, and cultural barriers. Another important aspect that needs to be highlighted is that around 90% of children living with disability in the developing countries are not in school, which means they would remain uneducated. And we know that there is a direct relationship between illiteracy and increase in disability and the amount of dependency on others. So these 90% of children with disability who are not going to school because of many reasons and lack of rehabilitation services are going to add to the global pool of disability in the decades to come. When we talk of the rehabilitation services available in the developing world, unfortunately, in many countries, they are either not available, they are not well developed, or they are not prioritized. And the priority goes to acute medical care, acute trauma care, and infectious diseases. And therefore, when it comes to rehabilitation services, there's only limited funding available for rehabilitation services because rehabilitation services take time, they're integrated, they're multidisciplinary, and they need a large input from a number of professionals. Sometimes finances and money has been exhausted by the time the patient reaches to a rehabilitation facility. And therefore, it's imperative that rehabilitation professionals need to decide and prioritize what works in rehabilitation and what does not work so that they can prioritize their resources and finances. And since we live in the 21st century and we tend to follow the principles of evidence-based medicine, and one of the largest resource for practicing evidence-based medicine is Cochrane. And that's why where Cochrane Rehabilitation comes in. Cochrane Rehabilitation was formed as a first global collaboration, and it serves as a bridge between Cochrane and all rehabilitation stakeholders. It basically drives evidence and methods developed by Cochrane to the world of rehabilitation, and on the other hand, it conveys priorities, needs, and specificities of rehabilitation back to Cochrane. Now, this was missing in the initial days. That we were practicing evidence-based medicine, but the community from Cochrane did not know that what exactly our priorities are, what we want to do, and how we can identify the gaps in research at a global scale. And now coming specifically to the rehabilitation professional based and practicing in the lower income countries, how Cochrane Rehabilitation can help you personally, professionally, which in turn can actually help your patients. First of all, if you join Cochrane Rehabilitation, it would allow you to be part of a truly global network of professionals. It would allow you opportunities at networking. Number two, Cochrane Rehabilitation would specifically offer you opportunities for learning, education, collaboration, and professional development. I'll give you two quick examples. So if you go and explore the official website of Cochrane Rehabilitation under the heading of Education and Training, you would see there are a number of evidence-based medicine courses that have been listed, along with some article and useful websites. In addition, Cochrane Rehabilitation also runs special projects. There is a whole list of the projects which you can explore, but they would give you an idea how you can contribute to this global collaboration of rehabilitation professionals from all around the world with an aim to improve the rehabilitation services in every part, including the lower income countries. Another important point that we need to understand is that maybe although rehabilitation paradigm remains the same all around the globe, but the priorities, need, and the little bit specificities of rehabilitation in lower income country may differ from higher income countries. For example, now we all know that there is a lot of role for robotic rehabilitation and other high-end technological rehabilitation in the developed world. But unfortunately, for most of the developing countries, these technologies are not available. So people based in the technologically advanced countries might not be able to gather evidence on the role of these low-end services that we provide in lower income countries. So it's important that people based in rehabilitation centers in developing world, they take a lead and they come forward and they identify their priorities and research gaps on which we can work together. So my call for action for my colleagues and rehabilitation professionals who are based in lower income countries is that please explore the website of Cochrane Rehabilitation. Address is given in the link. In addition, please sign up for the newsletter and we would keep you updated on the opportunities as they come by. And last but not the least, if you explored the website and if you're really interested, please feel free to email our headquarters at the email given and we would love to welcome you as a part of the family. So take care and be excited that we are going to celebrate the 5th anniversary of Cochrane Rehabilitation.